Hi and welcome to Physiofusion for knee pain. Today I'm going to show you a series of exercises to improve your strength, mobility, flexibility and stability, and to relieve your pain so that you can get back to doing the things that you love in no time. The knee joint is made up of the femur or thigh bone and the tibia and fibula or lower leg bones. The patella or kneecap sits on top of the femur and forms the patellofemoral joint. The quadriceps muscle is one of the main muscles that moves the knee. It's made up of the vastus medialis on the inside, the vastus intermedius in the middle, the vastus lateralis on the outside, and the rectus femoris along the top. When the knee becomes inflamed because of injury or arthritis, the inner part of the vastus medialis, called the vastus medialis oblique or VMO, actually turns off because of the pain. The vastus lateralis and another muscle called the tensor fasciae lata actually take over and become overactive. This results in the kneecap being pulled across to the side out of its normal groove, and the little fat pad under the kneecap becoming inflamed or swollen. This swelling then makes the VMO turn off even more, and the outside muscles become even more overactive. So what we need to try to do is strengthen up the VMO and get it coming in first before the muscles on the outside. It only takes 3 days for an imbalance like this to develop, but 3 months to correct it, because even though you're strengthening the inside muscles, the outside muscles are still relatively stronger. So when you're walking around from A to B, the outside muscles are still working more than the inside. So the key to getting rid of your knee pain forever is to do these exercises at least twice a day for the next 3 months. It's also a good idea to book in to see a physiotherapist who can make sure that you're doing your exercises correctly and who can help loosen off any tight muscles and get your knee joint moving a little bit better as well. If you are getting any pain in your hips or lower backs or ankles, it's a good idea to check out my Physiofusion for hip pain, Physiofusion for lower back pain, and Physiofusion for foot and ankle pain DVDs. For the next exercise, you're going to need your roll towel. So grab the towel and place it under your knees because we want to keep your thigh muscles relaxed. So this next exercise helps to improve the mobility in your patellofemoral joint between your kneecap and your thigh bone. So we want to try and keep the thigh muscles relaxed, and using one hand to stabilize the leg, place the other hand underneath the side of the kneecap and push the kneecap gently from the outside in towards the middle of your knee. So pushing in gently, hold for a couple of seconds and relax. Using the other hand on the inside to stop your knee rolling. If you do have a bit of arthritis under your knee, you might find that it makes a few noises. That's okay, as long as it's not painful. That's just getting movement back into your knee joint. Kind of like WD-40 in your knee joint, if you want to think of it like that. Then pushing the kneecap down, so place the heel of your hand on top of the kneecap and pushing the kneecap down. And cupping the bottom of the kneecap and bringing it up. For the next exercise, you're going to need a towel. With the towel around your ankle, pull the thigh back so that you can feel a stretch at the front of your leg. Keep the bottom leg bent up because that stops you arching your back. Hold for about 10 seconds and relax. Pulling the thigh back again. Keeping your ribs and tummy in, making sure that you're not arching your lower back. And now that we've done your mobility and flexibility exercises, we're going to do some exercises to strengthen your inner knee and bottom muscles. With all of these exercises, we're trying to get the inside muscle, the VMO, coming in before the outside muscle. So we want to roll the leg out to 30 degrees and put your finger either side of the kneecap so that you can feel which muscle's coming in first. Slowly and gently tense up the inside first and then push the knee all the way down so that you see this muscle on the inside tighten. Hold for 10 seconds and relax. Slowly and gently tense up the inside, push the knee all the way down. Hold for 10 seconds and then relax. Next exercise, you'll need your rolled up towel. So place the towel under your knee, roll the leg out to 30 degrees, put your finger either side of the kneecap, tensing up the inside muscle before the outside, bending your foot up and straightening your knee until the leg's fully straight. Hold for 10 seconds and then slowly lower your leg down. Gently tense up the inside, bend your foot up, straighten the knee, hold for 10 seconds and lower it down. Remembering to get the inside muscle coming in before the outside. So then we need to move the towel under your heel, making sure that your calf muscle isn't on the bed or on the mat. Rolling your leg out to 30 degrees, tensing up the inside before the outside, pushing the knee down, bending the foot up, lengthening the leg and lifting the heel up about an inch off the towel. Holding for 5 seconds and lowering down. Rolling the leg out, tensing up the inside, pushing the knee down, bending the foot up, lengthening the leg and lifting the heel up about an inch. It's important that you lift the leg up using the VMO, not using your hip muscles. We learn to walk when we're 1 year old, but no one really teaches us how to do it. Most people will walk badly and put extra pressure on their knees, resulting in premature arthritis and premature knee replacements. So when you do walk, your heels should be in line with the bony bits of your bottom that you sit on. Your little toes should be in line with your heels, and your knees should be turned out over the second and third toes. We do that by lifting your arches and squeezing your bottom cheeks together. Your pelvis should be still, and your knees should stay turned out over your second and third toes. If you do walk with a stick, you should hold the stick on the good side to take the pressure off the bad leg. And when you turn, you should always lead with the pelvis, not the knee. Because if you lead with the knee, you're going to actually roll your knee in, and your knee has to stay turned out over the second and third toes. So when you turn, you should lead with your pelvis, and then your knee and heel follow together. So now we're going to strengthen your inner knee and bottom muscles. Keeping your little toes and heels in line, arches up, knees turned out over the second and third toes, bending at the hips and sitting down into a chair, and then coming back up again. Keeping your arches up, knees turned out over the second and third toes, bending at the hips, and standing back up again. It's important to make sure that the knees don't roll in as you sit down and that they don't roll in as you stand up. If you do find this difficult, you might want to put a couple of pillows on the chair so that you don't have to squat down so far.
Or try using a chair with armrests so that you can push yourself out of it.